Everybody, August 5th, Tuesday, August 5th, week 6, Hematology and Oncology. Dr. Stavros here, USMLE trainings. Let's begin. Good morning, everybody. Good morning. Good morning. A wonderful beginning to a beautiful week, even though yesterday was Monday. Today is Tuesday. We usually meet every Tuesday, every Thursday, unless I change it because of my schedule. This week will be Tuesday and Thursday. And if ever anything changes, which I don't see it happening this week, you guys will be notified, right? So looking forward to seeing you guys on board. Good morning, everyone. You know, I have a team that kind of searches the website to get information, whether it be on Reddit, all different forums. And it gets upsetting. I mean, I see a lot of different questions pop up over and over again. And it either seems to me that a lot of people take advice from just anyone, or they just feel that this exam is, I mean, it is difficult, but the questions that I see are just, it's upsetting. And it's actually frustrating at times because people need to understand what they're dealing with. And I really feel that many people who try to attempt this exam, they either don't have an idea of what exactly, hello, doctor from Brazil, wonderful to see you. They're not really sure what they're up against, right? Clearly, if someone has taken the test and has not passed and they go on a second time, obviously they have an idea of what they're going through. But, when you have questions like, how many hours a day and, what do I have to study? It's a lot. Of course, it's a lot. That's why, all the courses out there and video series that exist, they're all pretty good. It depends what resonates with you. And I hope clearly you're here for a reason. So I resonate with you. I do my very best to take into consideration all the doctors I work with, the students I work with, whether you are currently in med school or practicing physician in different parts of the world, and you're trying to get into the States, it's tough, right? So, I mean, it would be very challenging to work and practice and be in medicine and have all this clinical knowledge, and then have to go back many, many steps and learn the little basics. So that's why when I do have these sessions weekly and I create the questions that I have for the QBank videos and I create content, I try not to create just whatever I think is going to sound good. I really create videos and topics that I know you'll profit from. Because if I was working full-time, part-time, in med school still working, right? When you're in med school, you're usually in class 8 to 5. Nowadays, everything is on the computer. Even if you are at school in the islands or in the States or overseas, sometimes you could still not have to go to class, but still you have to physically be preoccupied or occupied for many hours. So whether you're a med student, 8 hours a day studying or in class or Zoom, whether you're seeing patients, working part-time, research, working 2 jobs to pay the bills, to get back to school, whatever it is, time is valuable and priceless, okay? And I'm always honest with you guys. If you realize that some information we talk about really is like going over your head, like I don't know it, I'm not familiar with the terms, which I have some students who tell me, hey, I got to go back a couple of steps. I'm not really there yet. Well, then you take more time. Could be 5 days, 6 days, 10 days. I don't know.